presentation?
Yes, we can. Yes.
Okay. Well, hi, my name is Ana Ortiz. I am one of the PGY4s in the University of Puerto Rico's program. I am currently one of the chief residents as well for this academic year. And I'm just going to tell you a little bit about our program. Um, we are an ACGME accredited program associated to the University of Puerto Rico. This is a residency program that will initially started in July 1st, 1967, and since then it has been accredited throughout all these years without any observations. We are a 12 resident program. We have 3 residents per year. So that means we are actually a categorical program. And here you see our entire faculty and residents in our school. Basically, in order to introduce the faculty, we have Dr. William Michel, which is our chairman and the Sports Medicine Fellowship Program Director. We also have Dr. Carmen Lopez. She is our program director as well. And we have associate professors that I think you might recognize. We have Dr. Walter Frontera, who MD, PhD. He is the immediate president of ISPRM this past year. And we also have Dr. Luis Baerga, who is also an associate professor of the Sports Medicine Fellowship. And he is well involved in our residency didactic activities, specifically in MSK ultrasound workshops. And as I mentioned before, we are a categorical residency, so therefore we have our PGY1s match with us, and we are 3 resident per year. These are the PGY4s. Here we have myself, Dr. Richard Fontanes in the middle, who is the other chief resident, and Antonio Lombardi Gonzalez, who is also online for any questions in the end. We have 3 PGY3s as well, and 3 PGY2s, and our recently matched PGY1s. Now, in order to describe basically how our residency works, the PGY1s match into our residency, and they rotate in a flexible internship, you might call it. The first 6 months are comprised of internal medicine, pediatrics, emergency medicine, and then the second semester they rotate through neurology, rheumatology, orthopedic surgery, radiology, and that includes 1 month of PM&R. Important things about this flexible internship: once they start their second semester in January, they are a part of our didactic activities in the morning. Therefore, they start becoming familiarized with PM&R and how our residency works, which is a huge benefit when they transition from their first year to their second year of residency. One thing also on this slide, this year we started with a research fellow. That this has not done before, but it's a really good benefit given that our residency actually has high flow of researches running, and we'll see how this goes with us. So in the future, you know that we have a research fellow that you can apply for. Our second year of residency is similar to the other second years in the United States and in the mainland. Basically, it's almost all inpatient rehab, 8 to 9 months. The resident that is in inpatient rehabilitation is also responsible for the neurosurgery consults. And then the other 3 to 4 months, they are responsible for general consults. Here, we basically see all the consults in the University District Hospital and the emergency room in San Juan's Medical Center. And they are also part of the outpatient clinics, which comprise of prosthetics and orthotics, procedure clinics, EDX clinics, chronic pain clinics, general clinics, and wheelchair clinics. And as I said before, they are part of the Electro Diagnostics lab. And one thing I didn't mention before, since the PGY1 residents are rotating with us for a month, they also start practicing in the EDX lab since PDY1, which is also really good. And then the PDY3 year is basically they're in the inpatient rehab, but their responsibility is greater. They are basically the senior of the team, and they are also responsible for their oncology consults. They range through 1 to 2 months in the general consults, as in the second year of residency, but they also start rotating in a more outpatient setting, with which is associated with trauma. The trauma center in the University of Puerto Rico's hospital is a level 2 trauma, and we see a lot of pathologies since basically this is the biggest hospital in the entire island. Therefore, all the trauma comes to us, and we see basically every consult in the hospital. And they are also in the Electro Diagnostic lab. Here we start with pediatric rehabilitation medicine as well, 3 months of it, and that is basically composed of the University Pediatric Hospital consults, outpatient clinics. These outpatient clinics are also associated to the MDA, since one of our attendings is the director of the MDA on the island. And it is full of procedures, Botox and baclofen pumps, refills, and monitoring with these patients, which is a really good rotation. We are also affiliated with the VA Caribbean Hospital in San Juan. I forgot to mention that in the island, there are 2 ACGME accredited residencies. One is associated to the University of Puerto Rico, and then the other one is in the VA Caribbean Hospital in San Juan. And there we do pain management for a month. And then we also do sports medicine for a month. Our sports medicine rotation is basically associated as well with the Olympic Committee, the Puerto Rico's Olympic Committee, which is a really good thing as well, since we have the opportunity to manage and evaluate and follow up high performance athletes and Olympic athletes. That we wouldn't have the opportunity to do so if it weren't associated with the Olympic Committee. And then in PDY4, which is mostly outpatient clinics, this is basically an average, but most of it is outpatient trauma. And then you do 2 months as well in the inpatient rehab as a senior resident. And you different to the other years, we have 1 month elective, and we can rotate anywhere as long as it is ACGME accredited and less than 4 weeks. And then our inpatient rehabilitation center is Encompass Health. I think we are one of 2 residencies that rotate in the Encompass Health network. And it's a 32 inpatient bed hospital. In this hospital, I heard mentioned the other program that you only manage PM&R problems or diagnoses, but in this hospital, we are basically the primary care physician. So we manage everything from their primary medical diagnoses to their rehabilitation needs. And we see everything: neurological, orthopedic, brain injury, spinal cord injury, trauma, cancer, and cardiac pulmonary diagnoses. And then the resident team is composed of 1 senior resident, either PDY3 or PDY4, and 2 PDY2s. And then we also have Electro Diagnostics. I think this is one of the strengths of our residency. We have Dr. Carmen Lopez, which is our program director. She's a very great mentor. She is very she's very knowledgeable in EDX, and I'm going to mention it further on, but one of the things is that we basically study EDX throughout the entire year. We have EDX didactics 1 to 2 times a week. So basically we end up reading the entire Shapiro textbook like 3 to 4 times throughout the residency while practicing twice weekly in the EDX clinics. So that is a major benefit throughout the residencies. One of the things that I really loved about it. And then we also have musculoskeletal ultrasound workshops. These are mentored by Dr. Luis Baerga, as well as the EDX didactics. These are basically throughout the academic year as well. We have didactic sessions weekly, and these are hands-on along with Dr. Luis Baerga and the sports medicine fellow. And then we have the MDA clinics, Botox and baclofen pump clinics. This is under the mentorship of Dr. Eduardo Ramos. He is one of our attendings and the only one subspecialized in pediatric rehabilitation medicine in the residency as at the moment. He's also specialized in spinal cord, traumatic brain injuries, and stroke, and it is one of the most special clinics throughout the residency, as we can practice baclofen pumps, Botox, and the management of these complicated patients. And then to talk a little bit about our sports medicine fellowship, this is also an ACGME accredited fellowship under the mentorship of Dr. William Michel. There is one fellow per year. And as I told you before, basically, we do a lot of sports coverages and manage and evaluate and follow up the Olympic and high performance athletes on the island. And it is a fellowship that is very focused on research as well. Dr. Frontera is one of the associate professors for the sports medicine fellowship as well. So this is key to graduating after completing a year of the fellowship. And then to talk a little bit about the didactics, we have monthly didactic blocks, and these are 5 hours per week. We have morning didactic sessions every day, and these are subdivided into blocks, physical modalities, spinal cord injury, brain injury, stroke, you name it. And we also have a block set out for in-training exams, the SAE exam, which is a really good thing as well. And then throughout the academic year, as I mentioned before, we're going to study EDX medicine, MSK ultrasound, functional anatomy, and clinical kinesiology. And then we take both the PM&R and EDX exams every year, from PGY2 to PGY4, and we give journal clubs and grand rounds throughout the year as well. And then one of the things I think while I was applying to residencies is that I would always ask what was the PM&R board passing rate, and at least within the past 10 years, there has been 100% passing rates. I think that is very important. It tells you a lot about how prepared academically the residency is. And that was one of the key points for me when I was applying to residencies. Another important thing is that this past February, both the Sports Medicine Fellowship and the UPR PM&R residency program were accredited for the next 10 years by the ACGME without any observations or recommendations. So that is a huge step in our residency, and we are very, very, very excited about that. And then we also like to talk about our fellowship matching rate. Every year, our PGY4 residents apply for fellowship. These are the recently graduated fellows, and they matched in spinal cord injury. That's Dr. Vives on the left. He's in the University of Miami. Dr. Calderin, she's in the middle. She's in sports medicine in St. Petersburg. And Dr. Gonzalez on the far right. He's in brain injury in Baylor College of Medicine, and we're really, really proud of them. And then we all always take advantage of the fact that we live in an island, and we are like 15 minutes to 20 minutes away from the beach. So every time we have the opportunity, we try to go to the beach, we play some beach volleyball, we go climbing. We are, one of the good things about being a very small residency, we are a small knit group. So we try to do everything together once our responsibilities are over during the day or during the weekend. So that's one of the things we like to do. We're mostly at the beach every weekend if we could, and pre-COVID times. And then we are really good on research. I forgot to mention it before, but we have a really detailed research program throughout the academic year. Since you're in PGY1, you start choosing your research mentor, choosing a research idea, and start developing that research. And every PGY4 prior to graduating has submitted their research for publication. And this is for the residents. We went to the AAP ISBRM this past March prior to the pandemic. And it's a really good experience. And apart from research being a requirement for graduation, we also have QI projects, which are also developed since PGY 1 year. And we have to graduate with a fully developed and completed QI project.
Hey, Anna, this is Vinny. You have 5 minutes left.
The application requirements, you can apply through ERAS and NRMP. And here we have the contacts. If you have any questions, there is my email. My name is Ana Ortiz, and Richard Fontanes, which is the co-chief resident, as well as the administrative coordinator. If you have any questions or any ideas or any things you would like to know, you can feel free to email us. And here in the bottom is basically the website where you can see the application process as well. And thank you very much.
All right, Anna, thank you so much for your presentation. We really appreciate it. You still have about 3 minutes and 50 seconds left on the clock. If students have any questions, looks like we have some questions there. This is your time to answer.
Perfect. Can you give please more details about the new research fellow? Okay, the research fellow that was implemented this year, basically the research fellow works under the mentorship of Dr. Walter Frontera, and he is going to help out and oversee all the research that is flowing through the residency, not in particular the residents research, but there's a lot of faculty that have active researches, and the research fellow is going to be a key component in completing those. It is an excellent opportunity. Personally, I think working under Dr. Frontera, it will always be an amazing experience. So we'll see how it goes. It's going to be the first year, so we will be able to tell you more in the upcoming months how it's going to work, but I think it's going to be an excellent experience.
All right, very good. You still have 2 minutes and 30 seconds. We'll give it a couple, about 30 seconds or so, see if we have more questions coming up. If not, we'll start to transition to the next presenter. I would again encourage you to share your email. I know you already did on the slides, but you can also type on the chat box so students can ask additional questions. And please visit our website as well, pm&rscholars.org. Go to the forum page where we have the University of Puerto Rico page there, so people can ask additional questions and we'll redirect those to you.
Thank you so much.
You're very welcome.